Okay, picture this. A really high-level cattle operation. Looks great on paper, Top genetics, feed's perfect. But the calving rates, year after year, they're low. Mysteriously low. Our deep dive today shows the problem is often right there, but maybe not where you'd expect. Welcome to the deep dive. We sort through the noise to get you the insights that matter. Today, we are diving deep into male infertility in cattle. We've pulled together a whole stack of sources covering, well, pretty much everything. Causes, diagnosis, management, our mission to pull out the key insights, maybe reveal some surprising stuff, and really get you up to speed on this area. It's often overlooked, but it's crucial. So whether you're prepping for a meeting or just curious about how this part of agriculture works, understanding these details, well, it's really valuable. Let's jump in.
Right, so we often talk about the female side of reproduction, and that's important, obviously. But our sources, they really hammer home that the bull, he's maybe the critical factor for herd efficiency. What are some of the less obvious ways an infertile bull can mess up a whole breeding program beyond just, fewer pregnancies?
Well, think back to that operation you mentioned, the one struggling. Here's something critical that often gets missed.
Yeah.
The actual economic hit from just one infertile bull. It can honestly be way worse and last longer than many common diseases we worry about. We're talking potentially millions just slipping away, not just in the calves you don't get.
Right.
But longer breeding seasons, feeding cows that aren't producing, setting back your genetic progress, it's way more than just animal welfare. It's a serious business problem.
That's a really powerful way to frame it, the sheer economic scale. But, okay, to get it, we need to understand the why. And what we found is, it's not just one thing causing infertility. It's this incredibly diverse, sometimes surprising range of issues.
Exactly. The causes are all over the place.
Sure.
We can start with anatomical abnormalities. So these could be congenital stuff they're born with, like persistent frenulum, or maybe the penis deviates. Things that physically stop successful breeding. It's kind of like, a top racehorse with a loose shoe.
Mm-hmm.
Seems small, but it completely stops performance. And then you've got acquired conditions, things that happen later, maybe injuries to the prepuce or penile hematomas from getting hurt.
So some are born with issues, others pick them up along the way, but then things get a bit more hidden, don't they?
Yeah, absolutely. This is where infectious diseases get really interesting and maybe a bit sneaky. One thing our sources really highlighted is how many diseases you wouldn't immediately link to fertility can actually devastate it.
Like what?
Okay, so bovine viral diarrhea virus, BVDV. People know it for other symptoms, right? But it can quietly cause inflammation in the testes, the epididymis, leading to poor semen quality, but the bull himself might look totally fine. It's like a silent fertility killer.
Wow.
Yeah. And there are others, specific ones like Campylobacter fetus, Trachomonas fetus, Brucella abortus. They all basically cause inflammation down there. Orochitis, epididymitis, seminal sicculitis, leads to bad semen. And then you've got things like mycoplasma, ureaplasma, even IBR infectious, bovine rhinotracheitis, causing things like balanoposthitis, which is inflammation of the penis head and prepuce.
That's quite a list. Are some of those trickier because the bull doesn't seem sick? Makes them harder to spot?
Precisely. BVDD is a perfect example. A persistently infected bull might show zero outward signs of illness, but he's shedding virus and tanking fertility across the herd.
Oof.
Then you've got preputial diseases. This is a really key physical area. Think about injuries, trauma to the prepuce or penis, barbed wire, thorns, maybe fighting other bulls.
Yeah.
This can cause things like phimosis, where the bull actually can't expend his penis out. Or the opposite, paraphimosis, where he extends it, but they can't pull it back in.
Okay, right.
And obviously, these physical problems just stop him from breeding effectively.
So we've got physical defects, these hidden infections. What about things from the outside? Environment, nutrition?
Absolutely critical, too, like heat stress. Just high temperatures in the environment, that can temporarily mess with spermatogenesis, sperm production.
Right. Heat's bad for sperm. We know that generally.
We do. But what the deep dive really stressed is how long those effects can last and how subtle they can be. It can impact breeding cycles way after the heat waves is gone.
Interesting.
And then nutritional deficiencies, especially trace minerals, lack of things like zinc, selenium, that can seriously impair sperm production. It can even lower the bull's libido, his drive to breed.
Okay, so with this whole minefield of potential issues, how do you actually figure out what's wrong? It seems like it all points to this one key thing the sources kept mentioning, the breeding soundness examination. The BSE, like a report card for fertility potential.
That's exactly what it is. It's the cornerstone, really. And it's incredibly thorough. It's designed to catch pretty much anything. It kicks off with a general physical exam. looking at overall health, body condition, how the bull's built conformation,
Yeah.
checking for lameness, any systemic illness that might get in the way of breeding.
That general health check
Hmm.
seems obvious, maybe, but I guess it's easy to forget that even a perfectly fertile bull, if he's lame, just isn't going to get the job done.
Exactly right. Performance matters. Then we get hands-on with the reproductive organ examination. This means scrotal palpation, feeling the testes and epididymides, checking their size, symmetry, tone, consistency, and crucially, measuring the scrotal circumference. That size directly links to sperm production capacity. Bigger generally means more sperm. Okay. We also do a penile and preputial exam, looking closely for any of those abnormalities we mentioned, persistent frenulum, deviations, scars, adhesions, any sign of disease there. And finally, there's rectal palpation. That lets us feel the accessory sex glands, like the seminal vesicles and ampullae, checking for swelling, hardness, maybe abscesses.
Wow, it really is a head-to-toe check, but focus right there. And the next step is confirming what's happening at the microscopic level, right? The actual sperm.
Precisely. That's the next big piece. Semen evaluation. We collect a sample. Methods vary. Could be electroejaculation using an artificial vagina, sometimes manual massage. Then that semen gets analyzed. We look at volume, color, concentration. Critically, motility, we need at least 30% of the sperm moving forward progressively.
30%, okay?
And morphology, how they look. We want at least 70% normal-looking sperm. We also check for things like white blood cells or bacteria, signs of infection.
So it's not just enough for the bull to look the part or even have the right physical equipment. The actual swimmers need to be good to go.
That's the bottom line, isn't it? And there's one more piece. Libido and mating ability. This is the practical side. Does he want to breed? Can he physically do it? We assess his desire, his ability to mount, how he ejaculates, sometimes by watching him with cows, sometimes using simulated setups.
It really paints a picture of just how thorough this needs to be. It's way more involved than maybe some people realize.
It is. And while the BSE is definitely the gold standard, our sources show that sometimes the problem is hiding even deeper, so we might need to pull out more specialized tools, like things like laboratory tests. Maybe culture the semen to find specific bacteria, run viral tests like a PCR for BVDV that's a super sensitive genetic test, or a serology for other infections. Blood tests can check nutritional status, like those zinc and selenium levels we talked about.
Okay.
We might also use ultrasonography. It lets us see inside, visualize things like lesions in the testes, fluid buildup, or problems in the accessory glands that you just can't feel by hand.
So if you're not doing a full BSE, maybe between seasons,
Yeah.
what are the immediate red flags, things someone might actually see out in the pasture that scream potential infertility issue?
Yeah, good question. You might see obvious behavioral stuff like his libido's down, he's just not interested, or he tries but fails to mount or ejaculate properly.
Right.
Any weird look to the penis or prepuce, abnormal shape, swelling, discharge, signs of pain, those are definite flags. And then just broadly, any signs the bull is sick, unwell, or lame, anything that could physically stop him or make him not feel like breeding, those are all things to watch for.
Okay. So knowing all these potential causes and how to spot them, the really big question is, can you fix these things? Or is an infertile bull basically, out of the game?
It really depends on the cause and how fast you catch it. So for preputial disease, like those injuries, treatment might involve basic wound care cleaning, disinfecting, maybe antibiotics, locally or systemically. We might use anti-inflammatories, NSAIDs to get swelling and pain down.
Yeah.
For severe stuff like a prolapse or phimosis or those penile deviation surgery might actually be an option.
So some physical things are potentially fixable. What about the infections or the nutritional side?
Yep, for infections, if we can identify the bug through culture, we can use targeted antibiotics that can help with orchitis, epididymitis, seminal vesiculitis. If it's nutritional, like low zinc or selenium, well, that's relatively straightforward. Use supplement to correct the imbalance. And for things like heat stress, it's about environmental management, providing shade, maybe cooling systems, trying to lessen that impact during breeding time. But the prognosis, it often ranges from good to guarded. Really depends on what's wrong, how bad it is, and how quickly it was treated. The tough reality, though, is that bulls with some congenital defects or really severe infections, the prognosis is poor. They might just need to be culled from the breeding herd to protect the operation's future.
Which brings us back to that economic impact you mentioned earlier. It sounds like prevention is absolutely crucial then, rather than just reacting after the fact. Did the sources mention cases where, not preventing these things led to really big problems?
Oh, definitely. Prevention is key. And yes, neglecting prevention, That's exactly how you end up with those chronic, unexplained low calving rates we started with. Those silent losses just accumulate. The single most important prevention strategy, regular breeding soundness exams, ideally before every breeding season. That catches issues early before they spread or cause major damage.
Before every season. Okay.
Beyond the BSE, it's about good management practices. Keeping bulls in good nutritional shape, but not letting them get overconditioned, making sure they get enough exercise. And finally, biosecurity. Solid measures to stop infectious diseases from getting into the herd or spreading if they do. That's huge.
When you connect all those dots, it just really underlines how vital that proactive health management is. It's not just about fixing problems, it's about preventing them. Understanding these details gives you a massive advantage. So to wrap up, we've really dug into the wide range of things that cause male infertility in cattle. We've seen how the breeding soundness exam is this comprehensive, gold standard diagnostic tool. And we've highlighted how important both treatment and prevention are for keeping a herd productive. You basically now have a shortcut to being really well informed on something that has a direct line to agricultural efficiency and even our food supply. You know, this whole dive into cattle fertility, it's a great reminder of how tightly animal health is linked to economics, even food security, which makes you wonder what other areas, maybe areas that seem kind of niche in animal health, actually have these huge, widespread impacts that maybe we tend to overlook. Something to think about.